Beautiful images from Ahmedabad. The lady you see there in the black walking in is a coronavirus survivor. She made a full recovery, and this is how her residential colony welcomed her back. A ceremonial swagatam for a coronavirus conqueror. This is in Ahmedabad. No stigma, no prejudice, no bigotry, but a heartful welcome for a lady who has triumphed over coronavirus. May every person infected with the virus recover in a similar way and receive a similar welcome. We salute this young woman who's triumphed over COVID-19. Also on the show, images coming in from Bareilly in Uttar Pradesh, where you see a large group of people on the road being disinfected with a spray. The health ministry is on record now to say that this was the overzealous action of authorities on the ground and it should not have happened. I'm Shashi Tharoor. Thanks so much for tuning in. This is 5 Live and these are the headlines. The death toll has now climbed to 35 across India in the coronavirus pandemic with over 1,100 cases. The death toll is the highest in Maharashtra. Politics over PM Cares Fund. Shashi Tharoor questions transparency of trust under PM's name. Says why not rename PM National Relief Fund as PM Cares? Supreme Court seeks status report from Centre on steps taken to help migrant workers. Hearing to resume tomorrow. Army refutes viral messages suggesting likely declaration of emergency in mid-April with the deployment of the military. Says the information is absolutely fake. Global coronavirus death toll crosses 33,500. Number of cases passes 7 lakh mark. Italy tops death toll. US has the highest number of infections. And first, straight to our coronavirus dashboard where we get you the very latest authenticated figures. Remember, there are different figures doing the rounds. These are official figures released by the government at this time. The total number of positive cases at this time is 1,197. That's the number of cases, out of which the active cases are 1,052. Those who've been cured so far is a healthy figure of 110, including the lady you just saw. 35 people have so far died in the country. This is information until 4 p.m. today, so it's the very latest. Now let's take you through the worst affected states at this time. Till the 30th of March at 4 p.m. Total number of cases in Kerala stands at 202. That makes it the state with the largest number of cases at this time. Active cases 182, 19 people cured, and 1 person has died in Kerala. So far, Maharashtra is the state with the highest, I beg your pardon, the highest number of cases in Maharashtra with 215, 172 active cases at this time. The cured number is 34 and the number of people who've died is 9. So Maharashtra has the maximum number of deaths so far. Karnataka has a total of 83 cases, active cases is 75. The number of people who've been cured is 5 and the number of deaths in Karnataka is 3. So that's an overview of where things are at in terms of the data surrounding COVID-19 in the country. Now let's take you through the top 5 developments on coronavirus across the country. The death toll, like I said, in India has now jumped to 35. Pune in Maharashtra reported its first death today. Maharashtra continues to be the worst affected with 9 deaths so far, the highest in the country. 11 more coronavirus patients have recovered, taking the total number of cured or recovered patients to 110, which is a very healthy figure. The number of active COVID-19 cases in India has also surged to 1,052 after fresh positive cases have been reported from Maharashtra, Jammu and Kashmir, Tamil Nadu, Andhra Pradesh and Madhya Pradesh. The trauma center of the Delhi All India Institute of Medical Sciences has now been converted into a COVID-19 dedicated hospital. Remember, on Sunday, 23 new virus cases were confirmed in the national capital alone. Meanwhile, 6 more people who were evacuated from Iran have tested positive for coronavirus in Rajasthan's Jodhpur. Earlier, one person had tested positive after being rescued from Iran on the 25th of March. And the place that I am broadcasting from currently, it's the suburb of Delhi called Noida. It is in Uttar Pradesh and it is now emerging as a new hotspot of the coronavirus in the National Capital Territory. The total number of cases as of now in Noida is 31. Most of the cases have foreign travel history. And in view of the surging number of cases, the lockdown in Noida has been tightened and the border with Delhi has been sealed. Noida, if you are not familiar, viewer, is a suburb of Delhi, technically in Uttar Pradesh, where a large number of television channels operate from. Chief Minister Yogi Adityanath, as you can see, conducted an aerial survey of Noida today. He also met with officials in connection with the spread of coronavirus cases. And now I want to take you straight to India Today's Ankit Gupta. He's a journalist with our group and he happens to be under quarantine inside a residential facility, a residential complex in Noida that is under complete lockdown because a number of cases has been reported from there. Ankit, welcome. I hope you're doing okay. Take us through, what you know so far, Ankit. You're in a colony in Noida that is currently fully under lockdown. How did this happen? How were the people identified? Take us through all of that.
All right, Shiv, I'm doing well so far under this lockdown. I will tell you this, that at this point we know that there are 5 people from a certain family who have been tested positive. These individuals, the gentleman who heads the family, works in a company in Noida, who was in his office where he met with a gentleman who had come from the UK. They had an audit meeting. This gentleman was coughing in their office. They didn't know at the time that he was unwell or that he had COVID-19. He went back and the gentleman got infected. He passed it on to his 4 family members. 2 of them, the gentleman concerned and his brother, were first taken away on the 25th of March. The others had been in quarantine since March 15th. The family had self-quarantined itself since March 15th. But on 25th of March, these two people fell sick. The health department was called and they were taken away to a facility. On 27th of March, the remaining 3 individuals in the house, his mother, wife and the daughter, they also fell sick. The health department was called and then they ended up testing positive. This family came in contact with this gentleman from the UK. Now it is also being reported that from the same company, from the same group where the gentleman worked in Sector 135 in Noida, there are about 18 people who had come in contact with the same gentleman from the UK, and all of them have tested positive. Their numbers are included in the 31 number figure that you gave us.
Ankit, what about the arrangements that have been made in the colony? I know that all of India is under lockdown now, but you are literally inside a colony that has some of these infected individuals. What kind of special arrangements have taken place in the colony? Have there been any special announcements as well? We know that panic can spread quite easily.
Had made an announcement within the residential complex saying that they are locking down the society. However, that essential services were going to be available at the gate. Nobody was allowed to come out of the society or enter. All essential services in terms of vegetables, milk, anything that you needed would come to the entrance of the society but not actually enter. The administration from within and the RWA had circulated messages that there was a certain specific time that you could go to the gate and collect everything. This was in a period of 3 days. Today is day 3 of the lockdown. The entire society is currently being sanitized. But having said that, the essential services have not really been affected. at the same time, it's not as if that you could just walk to the milk booth and get milk immediately.
Absolutely.
You would have to stick to that stipulated time early in the morning where you could go and collect everything.
31 cases in Noida, 5 of those cases in the colony that Ankit is speaking to us from. Be well, Ankit. Hope to see you back very soon after your quarantine period gets over. Stay well, stay fit, and we'll see you on the other side of this crisis. Thanks for joining me from that quarantine. The other big hotspot that's emerging right now is Tamil Nadu, which has witnessed 17 new cases of coronavirus today, the single highest spike in the state since the crisis began. With these new cases, the total number of active COVID-19 patients in Tamil Nadu has risen to 62, and there have been 67 cases in total. As many as 10 new cases were confirmed from the Erode district. According to the State Health Minister, these fresh cases were identified through contact tracing, and all patients have been admitted to hospitals. State Chief Minister Edappadi Palanisamy is monitoring the situation. 25 lakh N95 masks have been ordered. Over 17,000 isolation beds and 3,000 ventilators are ready in both private and government hospitals across the state. "17 new cases in a single day makes this the biggest spike that Tamil Nadu has seen so far. 67 cases in total, out of which 62 cases are currently active. The others are all cases in which patients have recovered and been discharged, thankfully, from hospitals. So 67 cases in Tamil Nadu, 62 of them currently active. And now to show you an image that has gone completely viral today, sparking outrage, especially on social media. Is this an image of insensitivity? Is this an image of overzealousness, as the Health Ministry has called it? Or is this just an image of desperation of officials faced with a difficult situation and unmanageable numbers? Migrant laborers and workers returning to their homes from cities were forced by administration in Uttar Pradesh's Bareilly to take an open bath in groups with sanitizer solution before they were allowed entry into the district. As you can see on your screens, workers were made to sit outside satellite bus stations in Bareilly and were sprayed with sodium hypochlorite solution. The workers were allegedly sprayed with the disinfectant to prevent the spread of coronavirus. The video of the incident has gone viral on social media. A man can be seen directing the workers to turn and close their eyes while the disinfectant is being sprayed at them. While the rescued stranded Indians from abroad in special planes were brought in with VIP treatment, this is how migrant workers have been administered the disinfectant. The fact is this apathy? Is this negligence? Or is this simply a crisis in which authorities simply cannot cope? The Health Ministry just a short while ago at its press conference, reacting to a question on these pictures, said this was simply the overzealousness of officials. The BJP spokesperson Amit Malviya has just shared a video on social media showing a similar kind of spraying on individuals in Kerala as well, and he says that there is a hypocrisy going on against Uttar Pradesh, but images of this kind have been going viral. I want to go straight across to India Today's Nilanshu Shukla for more on this. Nilanshu, the Health Ministry reacting to these images from Bareilly says that this was the over-enthusiasm or over-zealousness of health authorities in Bareilly. Has there been any reaction from the UP government on this?
Shiv, it is said that one goof up and all your good deeds go in vain.
Yeah.
The administration across the state is trying its best to implement the lockdown. Food is being provided to the needy by the health officials, by the district administration officials, municipal corporation workers. But this inhuman act by the Bareilly officials are being criticized because chlorine mixed with water, which is being used as disinfectant, was sprayed on the migrant workers. This is what the Chief Medical Officer of Bareilly has also confirmed. It has been widely criticized by various political parties, leaders like Priyanka Gandhi and BSP Supremo Mayawati have criticized it. So we will have to wait and watch what action is taken by the Uttar Pradesh government. But somewhere this has brought a huge flag for the Yogi Adityanath government and the Bareilly district administration, because the migrant workers who are returning to UP are already suffering a lot.
Yes.
They are not getting proper food. They are walking miles to return to the homes of them, or also carrying their children with them. They have no source of income. So we will have to wait and see the government's reaction. But Chief Minister's office has taken cognizance of this incident which has happened in Bareilly.
I also, because, Nilanshu, since this is a situation that has become unmanageable in many ways, like you said, one image can destroy a lot of the good deeds. The UP government has been praised in many ways for some of the things it has done. But I also want to play devil's advocate and ask, is it the case that this is not so much insensitivity as much as the numbers being unmanageable? Since the numbers are so large and since targets have to be met, many of these state authorities are finding it difficult, and therefore they are having to do this. And it's not meant to demean anyone, but it's a critical situation, and that's why they're doing it.
Shiv, what we have been told from our sources in the government is that no such order has been given to any district authority to spray disinfectant on the migrant workers or the people out on the streets. So somewhere this act of the Bareilly administration is questionable. We will have to wait for a detailed report from the district administration, which has also been sought by the government, and we will have to wait as who ordered spraying of disinfectants on these migrant workers. So a detailed report has to be submitted by the Bareilly officials to the government, which has already been sought, but it is expected that action could be taken against the district officials in Bareilly.
हालांकि हम लोग ये उम्मीद कर रहे हैं कि जो सख्ती से लॉकडाउन का आदेश है,
Okay, we've got breaking news. Nilanshu, thank you very much for that. We've got some breaking news coming in now. With the rising number of coronavirus cases in Mumbai, the Brihan Mumbai Municipal Corporation is going in for GIS mapping, that is geo mapping of the areas which have seen the maximum number of cases of corona positive cases. Maps and details of these areas will be available on the BMC website. This is a way of specifically providing real-time data of where the coronavirus cases are, which will allow people to avoid those areas as well as target rescue and relief materials and other activity. People staying in those areas and people going to those areas can, using this new data, take more precautions as well as people already living in those areas. Sahil Joshi with us live from Mumbai. Big development, Sahil. Geo mapping of the most affected areas of Mumbai, which is already a very congested city. The fears of community transmission are probably highest in Mumbai. It already has the highest number of active cases, and that is why the BMC taking this big step to geo map the affected areas.
Absolutely. Now we are in the third week of the coronavirus spread in Mumbai, and the number of cases which are increasing in Mumbai, now it looks like that it has spread in some clusters, specifically in some areas the number of cases are on rise. Looking at that, the BMC now has decided that these areas will be mapped. These maps will be made public. Earlier the administration was hiding the information about the people who have been found positive, their places, their residences, their areas, but now they want to make this area public. No individual information will be made public, but the areas in which these cases have been found, those areas will be made public. Some of the areas, like the information what we are getting, that two areas in Worli area, Koliwada and Janta Colony, have been completely cordoned off at this point of time. They are being sanitized. Extra precautions are being taken there. So basically the BMC wants that the people who are staying in those areas or the people who are venturing in those areas for some work should be taking extra precaution. At the same time, even administration will have that room to sanitize the area and also look into the every case which is coming out of that area to understand how, whether it is spreading or it can be stopped at the correct time. So that's why this is going to be a major step, and it looks like that to control the coronavirus, that is what the BMC is thinking at this point of time in Mumbai.
Sahil, for getting us the latest on that. Hopefully this information will help the people of Mumbai as well as relief workers going forward. Geo-mapping of the affected areas to provide specific data on where those cases will be. Okay, in most COVID-19 patients, healthy tissue in the lungs are damaged, because of which it becomes hard to deliver oxygen to the blood. That is the centerpiece of this disease. This is where ventilators come in. India Today spoke to Dr. Sameer Bolia of Apollo Hospital in Noida, right here, who explains how it works. If you've been wondering about ventilators and why India is desperate to get ventilators and is about to order about 10,000 of them also from China, here is what that's about.
A lot of conversation these days is about ventilators. What are ventilators? What do they do? And does every COVID-19 patient require one? We are at the Apollo Hospital in Noida, and with me is Dr. Sameer Bolia. Dr. Bolia is an anesthetist and a consultant in intensive care. Dr. Bolia, what does a ventilator do?
This is a ventilator, and it is basically used to deliver oxygenated air, breathing, to a patient who is not able to breathe on his own, or who is fatigued, or who is into multi-organ involvement and who requires a therapy for oxygenation. So this is a machine. It delivers the oxygen, it cleans the air, and then continues to give oxygenated air to the patient, breathing in and out.
Sir, does every COVID-19 patient who tests positive, would he or she require a ventilator?
It's not like that. Not all patients would need ventilator. Any patient who has a respiratory problem, only maybe 5% would need a ventilatory support, especially in COVID also.
And remember those pictures we just showed you from Bareilly, which have gone completely viral? Well, it's created a bit of a political stir now. The BJP's national online head Amit Malviya has now shared a video of a similar kind of disinfecting taking place in Kerala. And he's also said that the virality of the image from Bareilly, and we'll put these two pictures in two windows so you can compare the two. And he says that this is a conspiracy against the UP government because it's doing good work. This image has been tweeted out by the BJP's Amit Malviya. Hundreds of thousands of Indians live in gated colonies and designated residential areas which have residents' welfare associations. And in the time of coronavirus, these residents' welfare associations have empowered themselves with a variety of tasks. And there are mixed stories coming in from different parts of the country. India has a 21-day lockdown. 1.3 billion people have been asked to stay at home in an attempt to prevent the spread of coronavirus. But resident welfare associations across the country are playing a very crucial role now in preventing the spread of the virus. Some good and some bad. Take a look. If you live in a gated colony, you know what we're talking about. Resident welfare associations. Across the country, they've now become the first line of defense against the COVID-19 pandemic. From barring entry to visitors to enforcing social distancing, RWAs are at the forefront. Let's take you across the country to see how it's working out. In Delhi's Ashok Vihar, the RWA is in constant touch with the people and social organizations, making sure that people's needs are being taken care of.
कोविड-19 से जीत गए तो
आप सबसे भी अनुरोध यही है कि प्रशासन जैसा कह रहा है वैसे वैसे पालन करें, वरना अगर इटली वाली जैसी पोजीशन, अमेरिका जैसी पोजीशन या वुहान जैसी पोजीशन दिल्ली में बन गई ना, तो कैजुअलिटी कितनी होगी हम इमेजिन नहीं कर सकते। और विशेषकर अशोक विहार तो 2-3 साइड से क्लस्टर से घिरा हुआ है।
In Delhi's suburbs of Noida and Ghaziabad, many RWAs have been issuing guidelines on the precautions to be taken to avoid infection.
हमने इसमें क्या किया है, कुछ गाइडलाइंस तय की हैं जिसमें कि आउटसाइड वेंडर्स, मेड्स वगैरह को हमने बिल्कुल बैन कर दिया है सोसाइटी में, कि कोई भी हाउस मेड्स वगैरह सोसाइटी में अलाउड नहीं है। दूसरा, कोई भी दूसरे वेंडर्स जो होते हैं, होकर है या कोरियर वाले हैं, उनको सोसाइटी के अंदर जाना मना है।
Housing societies like this one in Kalyan in Mumbai have even installed a wash basin at the society's gate. Even milk packets are being sanitized here.
As a precautionary measure for COVID-19, several housing societies have now started taking precautionary measures at the entry gate itself. We can see over here at a housing society in Kalyan where milk packets which were delivered at doorstep are now being kept at the reception itself, at the security check itself. These packets are sanitized and only then delivered to the person to whom the delivery was to be made.
Housing complexes are also spraying disinfectant in every corner of the society on a regular basis.
Every few hours we are disinfecting the door handles of every block, then the lift buttons in every floor, inside the lift the buttons, and we are advising the entire community, all the people here who are living here, we are telling them to disinfect their apartment door handles and everything.
People have been deputed to clean the entire premises. There have been multiple steps taken by Residents Welfare Association wherein they are employed their labor force to clean all important places where people tend to touch, especially like the doorknobs, lift buttons, and also there have been proper awareness posters which are also set up.
The RWAs at Richmond and Langford Town in Bengaluru have closed the park to avoid crowding. They're also warning people on fake news on COVID-19 through WhatsApp groups.
The CWA, that is the Citizen Welfare Association, Richmond and Langford Town, they decided that people should not come to this park because you're congregating in large numbers, and hence it negates the social distancing that is being asked not just by the state government but also by Prime Minister Narendra Modi. That is one. And two, the children's play area over there, you can clearly see they have actually put the tape around it so that children or kids do not come over there and play, because if someone is infected, you're touching the same thing. You're touching all the rods. A person who's hale and hearty, that is a child, will also touch the same thing or same rods and touch his or her face. So that is one of the reasons they decided to take this particular step.
But for every bit of good, there's also bad. There have been several complaints that RWAs are acting in a draconian manner and sometimes being very finicky. Couple this with incidents where RWAs have been accused of hounding and harassing individuals, especially doctors and airline crew members.
I wanted to buy some groceries that we really needed, and there were no groceries in my sector. The only one shop that was open in my sector, they did not have this stuff. When I was trying to enter the sector, the guard tried to stop me. I tried to explain him that why I'm here. I'll just take 5 minutes. I'll buy the stuff that I need to buy because that's the only place we go. Usually every time, but guards, they started throwing a big huge tantrum, and they tried to stop me. One of the guard even came in front of my car and said, "Madam, nahi jaane denge, hame strict instructions hain." So it was quite a bizarre situation. I just wanted to say that, you know, we all are responsible citizens. We are following what the police is saying, what the government is saying, and I don't think so the RWAs should stop us to go out or to enter when we want to buy our essential things.
The war against coronavirus calls for plenty of discipline, and towards this end, resident welfare associations are playing a very important role. But are there more heroes or are there more villains? With Divyesh Singh in Mumbai, Akshaya Nath in Chennai, Nolan Pinto in Bengaluru, Bureau Report, India Today. So these are some of the things, some of the experiences people are having with their resident welfare associations across the country. Joining me live now, and we'll go to them in just a minute, we have Parul Gaur, who's Joint Secretary of Delhi's Vasant Vihar Welfare Association. So she is part of an RWA and deals with this on a daily basis. Parul, welcome. Ankit Tyagi is our editor who's been plugged into all of these developments in Delhi and beyond, and he's also been filtering through many of the reports and the experiences people have been having with resident welfare associations. But first, some facts. This is the kind of information that we're getting from viewers who live in gated colonies. Let me take you through some of those pointers. Number one, many say that RWAs are banning domestic helps and delivery boys from entering the colony. You may be familiar with that. Many are banning newspaper walas. Newspaper deliveries have been banned by RWAs in certain colonies. There are reports, you couldn't have missed these, there are reports of harassment and hounding by RWAs of doctors and healthcare officials and even airline crew, by RWAs who are a little overzealous about their responsibilities. Government orders aside, there are some RWAs which are imposing their own draconian rules within the colony, and we're even hearing about some RWAs which are actively limiting the movement of residents for essentials, even though they are not legally permitted to do so, but they're creating their own rules within the colonies. So here are some questions for millions of viewers who live in colonies and have to deal with RWAs at this time. These are not loaded questions. Remember, RWAs do fantastic work. It's a thankless job, but these are questions that we think should be in your minds as well. Are you feeling victimized by your Residents Welfare Association? Is your RWA being empathetic, or is it being draconian? Is your RWA making you feel insecure or imprisoned in your gated colony? Is your RWA sharing useful information or useless gyan on WhatsApp and announcements that are jamming you up and confusing you? In such a crisis, are you happy to let RWAs lead? Are you happy to see them empowered with a certain amount of power instead of standing back and letting things just proceed? And finally, are RWAs being more harsh? Is it a necessity or is it a safety? That's the questions we're asking here on 5 Live. Parul, I want to come to you very quickly first. As a member of the Vasant Vihar Welfare Association, what has your experience been like? This is a difficult time. Many RWAs like yours, I hear, are doing very good, empathetic, compassionate work. But there are also many of these cases where we're hearing about incidents of dadagiri, people taking things into their own hands, and a lot of residents are quite unhappy.
Good evening all. I think our welfare association, the Resident Welfare Association, has been working very proactively, and instead of creating problems once this 21-day lockdown was announced, we decided to create a comprehensive guideline advisory for all our residents so that this 21-day lockdown period becomes easy for all of us. We have a six-page document wherein we answered all the frequently asked questions, a list of do's and don'ts for them. We realized the issues that our residents will face in the coming days, and we have tried to give a solution to each one of them. So the there is a list of essential services, your daily needs, which are covered in that list. Home delivery services that are provided to them so that they can practice self-isolation to the maximum. We also have in that advisory a list of chemists and utility services. Okay. The plumbing jobs, the electricals. Yeah.
Okay. Ankit, ultimately this is a thankless job. While we've been getting mixed results when we look at RWAs across the country, ultimately this is a thankless job in a situation where there are more uncertainties than certainties, Ankit.
Absolutely, Shiv. There are a lot of people, those who associate RWAs with, people, those who are retired, just doing it, getting a sense of purpose of where they're living. But just let me clarify what is the position of the RWAs vis-a-vis the law. Yes. So the RWAs are basically voluntary citizen bodies which are registered under the Societies Registration Act 1860. It is not a legal body. So the RWAs don't have any legal right to infringe on a homeowner's privacy or speech or, in that aspect. But yes, they can make certain rules and regulations when it comes to the matters of building maintenance functions or, even as far as the day-to-day functioning in the building is concerned, be it security, what time will what change, the maintenance of the building, so and so forth. Now, there are two aspects to what we are talking about. Like the member of the RWA from Vasant Vihar, like she was telling us, so there is one aspect of informing people of what has happened. These are your chemist shops around. This is what you can do. This is what you can't do. But the other problem, Shiv, like many of our colleagues, those who are in media, are also facing of RWAs using this kind of an atmosphere of fear, of panic of coronavirus on trying to infringe on what people are doing. No, we won't let you go, even if you are a doctor. Don't come back. You are going to spread, coronavirus in the society. That has to be checked. I mean, this can't, legally can't be done.
Yeah.
And as far as the other work is concerned, it's a great job of, trying to unite people and keep things moving as far as these times of uncertainty are concerned.
But, Parul, I know that your association is doing good work of informing people, being empathetic. What would you say about, many residents' welfare associations? And I'm sorry to say, we've got reports of this from many parts of Delhi, Noida and Gurgaon, where people appear to be on a bit of a power trip. Suddenly you've got this crisis and these RWAs feel like they've got a little bit of additional power and they want to impose it on colony residents. What do you say about that?
I think that the way a certain RWA works, the credit of that goes to the whole committee as such. And we have a very visionary president in Mr. Bindra with us, who likes to take the bull by its horn. We have Ms. Murgai, we have Mr. Garg, who's a financial whiz, and we have tried to work cohesively along with the residents. Instead of challenging them or practicing some draconian laws, we've tried to understand why must a person need to step out if we are bringing a solution to their doorstep. So, in continuation to what I said, we have a panel of doctors who are available 24/7, who are within Vasant Vihar and have generously offered their services through the day and through the night. We have a helpline for all our senior citizens where we have volunteered to reach out to them should they need anything. And besides that, we have a mental health expert on our panel, a list of legal experts. So each solution is given in the guidelines. I can share that with you. It's a very comprehensive document of 6 pages which has got almost everything. And we are continuously updating that so that our residents don't have any issues. They come up with issues and we come up with solutions.
New problems.
So we are working beautifully together, and there is no
I think that's wonderful to hear that. I will take you up on that offer, Parul. I will take those 6 pages. We'll do a story on that as well, so RWAs across the country can actually learn from it. You wanted to add something, Parul?
Yes. Yeah, I wanted to tell you, and our RWA has some young people working, so I think that kind of balances. No, not only retired old people, but I'm relatively younger, and along with me, I have some wonderful volunteers, young ladies who are motivated and extremely talented, and we're all bringing solutions on the table. We understand it's a very hard time, but it's time to serve and not be on any power trip. This is the only time to serve and give it back to the society.
I want that message to go out to all RWAs that may be on a power trip. It's a time to serve, not a time for any draconian rules, not to impose rules and not to make life difficult. It's a new challenge for everyone. We're all in this together. Ankit and Parul, thank you so much. It's a pleasure listening to people who are really plugged into this activity right now. And this is important because with millions of people locked into their colonies, their movements restricted right now, they would like some reassurance that the people, the RWAs, which are functioning as their representatives, are having their best interests at heart and in mind. Well, as India is under this unprecedented lockdown till the 14th of April, despite whatever rumors you've been hearing, we know you're anxious and worried, whether it is about RWAs or essentials or other things. Don't worry, like we at India Today have been doing all of last week. We are with you at every step, and we will be taking up all of your queries and concerns regarding the problems you're facing during this lockdown. Remember, tomorrow, can you believe it? It's going to be 1 full week. We'll answer all your concerns and doubts, and we'll make sure that your voices are heard by the authorities.
The closure has been announced and all businesses have come to a standstill. How do you expect us to pay salaries, taxes, electricity bills, rentals? We don't mind sitting at home till the end of April. We want to know, can we look at a 6 months rebate on these points?
There's a lot of confusion, there's a lot of panic, mainly because of fake, wrong information circling around WhatsApp. And there's a lot of fear, the fear of being infected, the fear of losing their own life, the fear of losing our loved ones, the fear of limited access to essentials like groceries, the fear of loss, financial loss, losing your job and being bankrupt with your company, the fear of not being able to have that freedom anymore to go outside or to make any choices if you like, anger, boredom, traumatic stress. People experience more and more cabin fever. That means being, feeling claustrophobic, being with too many people in a too little space. So how to deal with our loved ones? We can't have them 24/7 with us, but we really love them. We really respect them. How to deal with them? How to deal and manage yourself?
We are an ancient civilization with a very beautiful, ancient, effective Ayurvedic system. I wish that we as people and we as the government take in partnership our very renowned Ayurvedic institutions that the world acknowledges and spread awareness about prevention, about protection, even about, supplementary care when you have respiratory tract infections. China is making it a mandatory thing. China is availing of its ancient system, and I don't see why we are not emphasizing prevention.
Your voices will continue to be here on India Today. Don't miss what's coming up at 6 p.m. We've got a path-breaking investigation, Operation Ventilator Vultures. Shocking investigation by India Today with Rahul Kanwal coming up. But I'm leaving you with some good news before that here on 5 Live. Good news for pizza lovers at least. India Today's Pooja Shali shows you how deliveries of pizza are finally back on and all precautions, in case you're wondering, are being taken. Enjoy.
What if you're hungry right away, want to take our delivery? Pizza. Alright, so Pizza Hut, we'll be seeing you soon. Stay home and take care. They have closed their restaurants from 25th of March until further notice. Take a look at this. This is the message of their team. What about Domino's? Okay, so Domino's is taking some orders. Let's try and add to cart. Alright, so we have placed 2 pizza orders and we add a Coke to it. Alright, so I've booked 2 pizzas for myself. Let's pay now. Order confirmed. Alright, so my order has been confirmed of a pizza at least. I am now going to wait for it to be delivered right at my doorstep. So he's ensuring that the food that is delivered is not being given to me directly. He's putting it in a bag and he's ensuring that all precautions are being taken. तो आप हाथ में नहीं दे रहे हैं किसी को अभी? No, हाँ? No. Distancing. Yeah, ma'am. फिर आप वहीं रख के जा रहे हैं, कैसे दे रहे हैं?
मैम हम पूछते हैं कि कहाँ पे आपको रखना है, कोई सेफ जगह बता दीजिए, वहाँ रख देता हूँ मैं, फिर उसके बाद हम चले।
He's keeping his distance. He's told me he's not going to give it to me directly. So जैसा आपको safe लगे, आप अपनी तरफ से यहाँ chair पे रख दीजिए sir. Thank you so much. Thank you. And you also stay safe. So they are taking all precautions. Home delivery is coming. He's wearing his gloves. He's wearing his mask. And he's not given the food to me directly, but my food is here. Thank you, sir. So my food has been delivered. Let's find out what is in it. And it is the pizza that's been delivered. My piping hot Domino's pizza is here. And he did not deliver it to me. He was taking precautions. I will also only wash my hands first. Then I will take a slice from this. We are at work, but we do need to also ensure that while we are eating, to take precautions. And some essentials are not being delivered in time. There's a delayed delivery like I saw. But some, like the pizza here, is being delivered to you in time. Stay indoors. Stay safe. Take care of yourselves. We are doing our duty here at work. I hope you are doing your duty as well. Thank you so much for watching. With Mahesh Kandpal, Pooja Shali.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video.
For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.